Hello everyone, it's Dr. Bianca. Today I want to talk to you about kittens. So as always, this video is to provide you with information from a credible resource and is not to replace your relationship with your veterinarian and is not to be taken as medical advice. So let's get started. With kittens and with puppies, it's very important that from when you get them, you build that relationship with your veterinarian. As always, they're going to be the person who helps you along your pet's life to make those, decisions regarding their health, their well-being, their behavior, things like that. So with kittens, we want to build up their immune system, and we do that with vaccines. Cats have 2 core vaccines and 1 vaccine that may be necessary for your cat or may not be, depending on their lifestyle. So the 2 core vaccines, one is rabies and one is FVRCP. That is a combination vaccine that protects against 3 different things. That's rhinotracheitis, calicivirus, and panleukopenia. The 3rd vaccine, that is not core, protects against FIV and FELV. So it's an infectious leukemia and also immunodeficiency virus. Now, the reason this one is not necessarily core is because some cats are at a much lower risk than others. But one thing that most vets like to do, and it's recommended by AAFP, or the American Association of Feline Practitioners, is to do a little blood test on cats to determine if they've been exposed to the virus or not, or either of those viruses rather, because that can impact their life, their lifespan, their well-being, things to look for in the future. So absolutely recommend doing that based off of the guidelines I mentioned. And as far as whether or not your cat needs the FIV or FELV vaccine is going to be based on the conversation you have with your vet. Another thing to mention is parasite prevention. This is still very necessary in cats, even if they stay inside most or all of the time, as we can track things in as humans from outside that put our pets at risk. Some pets live in a multi-pet household, so if there's dogs or other pets, they can pick things up from them. So absolutely, I recommend talking to your vet and making a parasite prevention schedule that works for you all. With kittens, they're going to be very amenable, so socializing at a young age is really important to help them enjoy their life moving forward. Making things like nail trims not a traumatic experience, and we do that by offering positive reinforcement at a young age when we're touching their paws, when we're doing those nail trims. And same thing goes for rubbing their gums to simulate teeth brushing, and also rubbing their ears, because down the line, if they get an ear infection, we want to make sure that's not the first time we've ever handled their ears, because that can be quite traumatic and impair treating the issue. With all kittens, I recommend looking into spaying and neutering. AHA has great guidelines as to when that should happen and why it should happen. And that's, again, something you should discuss with your vet if that's going to be what you go forth and do. They can tell you about timing and things like that, because, of course, it's going to be patient dependent, as everything is. Finally, things to watch for with kittens. They like to get into things, so things like string, hair elastics, bands, cords, anything string-like, a cat might go for it. So you want to make sure they're not chewing or even more swallowing these things. Also, things to look for with kittens are signs of upper respiratory infections. That's going to be eye discharge, nose discharge, sneezing excessively. And if you notice those, you should definitely talk to your vet. And then finally, with kittens, they can also be predisposed to having abnormal bowel movements, whether it's one way or the other, if you know what I mean. Definitely keeping an eye, and if you notice any abnormalities, you should talk to your vet. Like always, my biggest recommendation and take home is, when in doubt, talk to your vet. With a young kitten, setting them up for success is going to be building a relationship with a vet you trust from the beginning. And if things aren't working out, that's okay. You can definitely look around and see which vet around you is going to work best for you. But the most important thing is going to be building that relationship from a young age. So if you have any questions, please reach out. I've dropped all the links I've mentioned with a few extra ones below. So it's going to be your parasite prevention guidelines, vaccine guidelines, some cat care tips, etc. And you'll see all of those. We'll see you soon.